The Hub is presented by Calvo Enterprises, Inc.
Heart disease and strokes are by far the leading causes of death on Guam. The Guam Regional Medical City has just hired 2 more much-needed specialists for its cardiovascular team. That team now features 5 cardiologists and a nurse practitioner to help address the alarmingly high number of cases here. GRMC says with the addition of Drs. Bishoy El-Babawi and Mahesh Gola, advanced treatment for anyone suffering a major heart attack is now available 24 hours a day, 7 days a week. Coming up, our conversation with the new physicians who say time is critical in treating heart attack patients, and the addition of 2 new specialists will greatly improve the hospital's ability to respond and to save lives. The Hub will be right back.
The Hub is presented by Calvo Enterprises, Inc. The Hub is presented by Calvo Enterprises, Inc.
Good day, everyone, and welcome to The Hub. I'm Nasser Likanto, and I'm pleased to welcome our guests for this week. They are interventional cardiologists from the Guam Regional Medical City, Dr. Mahesh Gola and Dr. Bishoy El-Babawi. I got it right, I think. Thank you so much for joining us, gentlemen.
Thanks for having us.
All right.
Thank you.
Let me start with you, Dr. Gola. Maybe just tell us a little bit about your background, your experience, and your specialty. And then we'll go to Dr. Bishoy.
Oh, definitely. So, I did my medical school back in India, the college called Andhra Medical College. When I was in medicine, I came to mainland states. I did a rotations in University of North Carolina as a visiting medical student. And that's when I was really interested. I worked in cardiology. So that I decided I want to be a cardiologist, looking at what they're doing at UNC in a cath lab, especially. So, it's a journey. And I matched in a St. Elizabeth's Tufts University in Boston for my internal medicine. Eventually, I did my cardiology training and interventional cardiology and peripheral structural cardiology training there. Then in 2020, I'm done with the training and I moved to West Virginia and I practiced there for 3 years. So, but I just want to give it a try, it's just close to my country, Guam is. And I know a few of my colleagues are working in GRMC. So I just want to give it a shot. And my wife is a physician. We both decided to just, give it a shot. And we are here for the last 2 months and we are loving it.
That's great. I think Guam welcomes you and your specialty to the island. Dr. El-Babawi, tell us your story.
Story started in Egypt. That's where I was born, and I went to medical school there. I came like Dr. Gola, also same thing. I went and did a couple of rotations between Alabama, between upstate New York and Michigan. I started my residency in upstate New York, and then completed my first fellowship in Loma Linda in California, and then went back to the Midwest to do my interventional year. Came to Guam, honestly, as trying it. And same like Dr. Gola, same impression I got. I love it. I love the people. I love the service that we are offering. That's truly needed and truly appreciated by the people here. So it has been very satisfying experience, and we are looking forward to grow the program further and further.
Absolutely. I think the community, I can speak for them, welcomes any specialty physicians that we can get. Talk to us a little more about the advanced treatment that is available, particularly in your specialty cardiology, Dr. Gola.
So, the specialty-wise, interventional cardiology nowadays is very vast specialty. It used to be like only heart, blood vessel-driven specialty. But now the same physician who are training for interventional cardiology also doing a lot of work in blood vessels opening in the legs, kidneys, in the blood vessel supply in the heart. And we even doing catheter-based procedures to fix the valves. But primarily going back to the interventional cardiology, in olden days, the last 10, 15 years, what we were doing is opening a blood vessels within the heart arteries. Just like heart is a mechanical pump, right? It has, just like every pump needs a gas, It has a plumbing system. Heart has a blood vessels supplying the heart muscle. So those blood vessels, over a period of time, develop blockages. The blockages consist of cholesterol, and rest of the kind of other tissues, mainly cholesterol. So once they grow to the point where it compromises the blood flow to the heart muscle won't be efficient, won't contract. So those are the times we go in with the minimal invasive techniques, with the arteries from the hand or from the groin with the small catheters. We go into the heart arteries. We put a wires and balloons and the stents, and we open those blood vessels so that we can restore the blood to the heart muscle. So the heart will be back to the normal condition. That's what we do.
Yeah. Dr. El-Babawi, you want to add to that?
Dr. Gola summarized everything we are able to do or what we were trained for. Exactly, like we try to fight with that time limiting, life-threatening situation. When someone comes with a heart attack, we are really fighting against time. We call it in our practice, time is a muscle. The longer it takes for us to manage this patient or to take care of this pipe that's closed, the more time that this muscle will be struggling for blood. I make it simple to my patient and say, like, if you are having a fracture in your leg, either you're going to use a cane to walk, which is a medication, but also we can go and fix this. When we fix this, you'll be able to walk again. Same thing in the plumbing system, like Dr. Gola mentioned, we go and open the pipe in a timely fashion. We are trying to achieve what we call the door to balloon, which is the time the patient presents to the ED door with a chest pain, to the time that we open the pipe, to be limited to 90 minutes. And we have been very successful since we came here in achieving this time frame. So we have been really seeing a lot of great outcome. People who survive such a life-threatening situation, people who are having their heart muscle function recovers again, and people who walk out of the hospital chest pain free. So these are the three outcomes we look for out of this procedure. Rest of the procedure for the legs, of course, our job is to prevent leg amputation, which is something very, very well seen on the island, the amputation. And that's same risk factors that affect the heart pipes, affect the leg pipes. So our goal is to go and restore the blood flow into these legs. And the third thing will be the structural heart, and our more advanced substitute procedures to open heart surgery, stuff that they used to do, change the valve, have to open the chest. Now we can do this without opening the chest. Putting a clip on the mitral when it's leaky, when one of the valve is leaky, we can do that. We can also put a mesh in a what we call the left atrial appendage, which is a place where clots happen in patients with AFib, and then they don't need to be eventually on blood thinners if we put this mesh to close this appendage. So these are the a summary of like how broad our practice can be and what we are looking to grow here.
Yeah, and Dr. Gola, as you I'm sure know, the prevalence of heart disease on Guam is very high. Can you talk a bit more about that?
Yeah, relatively speaking, I was just going through a few articles recently, especially the statistics from the Guam Health. Obviously, it is the number one killer in the island of Guam. A lot of people are dying primarily because of heart disease and related complications. So if you look at 2002 to 2020 census here, especially mortality data in Guam, almost 59 times growth in terms of heart disease related mortality in Guam. That's extremely high compared to any mainland, any state, even though underdeveloped states in the mainland, still this number is too high, which relates to a lot of factors, especially the high blood pressure, diabetes, and high cholesterol, and at what age we have started smoking, and how long you're smoking, and how many packs you're smoking, and family history, some kind of genetic issues which kind of mess up the cholesterol metabolism and which can accelerate these blockages in the heart arteries. So, and obesity is another thing, very prevalent in Guam, based on the kind of diet they choose. So all these factors cumulatively accelerate the blockages in the heart arteries, not just the heart. It also can happen in the blood vessels supplying the brain, also the blood vessels supplying the kidneys and the legs. So, but unfortunately, these blockages, as Dr. Bishai mentioned, one day it's just like a silent volcanoes. They rupture, they erupt, and they completely shut down the blood vessel. So that's when the patient don't have enough time. We gotta, time is muscle. We have to open the blood vessel. That's what we do. And here, the prevalence of obesity is extremely high. Other risk factors, especially diabetes, is very high. So we are seeing a lot of heart and vascular disease.
Yeah, and Dr. El-Babawi, heart diseases, heart attacks are known as, the so-called silent killers. But also, anecdotally, I've seen a lot of young men younger than me, even in their 40s, who are dying from heart attacks on Guam. Talk a little bit more about that.
Actually, I have done younger than 40s. The youngest I have done since I came to the island in August was 30. But wow, there was no surprise, because when I met him in the ED and I asked him about any risk factors, he mentioned he just smokes. But a major thing he mentioned was his brother died of a major heart attack in his early 30s. So that really confirms that there is some sort of a genetic prevalence here on island that accelerate the coronary artery disease or heart disease, as we mentioned. I would say patients or people need to really know more about their family history. If they are aware of anyone in their family that has such heart disease at a young age, call it premature heart disease, because the prevalence usually for this heart disease to happen in the 60s, but younger than that, we call it premature. So if you are aware of anyone in your family that has heart disease before that age, be mindful about your own health and start seeking care, manage the risk factors. At a young age, might be easier to work on losing weight, work on seeing a doctor and getting your diabetes controlled, the blood pressure controlled, work on quitting smoking when it's still like that early, instead of like being there smoking for like 50 years and it becomes harder to quit. So this is what I have seen, and that's what I tell every patient I see.
Yeah, and Dr. Gola, for those who might have this predisposition, as Dr. El-Babawi was talking about, family history. So what can they do? Give us some advice on, sort of maybe change their eating habits, and should they have like regular checkups to know how far along they are, how dangerous it might be for them at certain points?
That's a great question, though. So specifically talking about family history. So if someone died young age, like a woman at the age of 65 and men 55 or younger. So first thing what I would do is when you are in teens, imagine these blockages develop when we are teenagers, even younger. These grow slowly over a period of decades. That's how these blockages grow by the time we reach 40s and 50s. They don't grow in a week or 1 year. So that means going back to when we know our aunts, uncles, dads, grandfathers, if anyone had a heart disease in teenage 20s, like a teenage age, you need to change your dietary habit and physical activities. So at least you have to do 30 minutes of aerobic activities 5 days a week. So that's basically great physical activity if you consistently do that over a period of time. And the diet wise, it's better to check with your primary care physician, your annual checkup. And they usually do draw labs to check your lipid profile. So just to make sure it is normal, if it is not normal, and just make changes your dietary habits. So if you're really at high risk and if your cholesterol is not getting better with your dietary changes and lifestyle changes, the next thing what we do recommend is there is a thing called CT calcium score of the heart. So it's a glorified X-ray. So it's with very minimal radiation and very economical too. So what it does is a flash picture of your heart and tells you how much calcium depositing in your heart. So if you know significant calcium depositing in your heart, which shouldn't be there, normal calcium is zero. If you know there's calcium depositing in your heart arteries, that means you're developing blockages already. Those are the patients who will get benefit from cholesterol lowering medications. Like best example is statins, Lipitor and Crestor, along those medications. These are the medications I would recommend at early stage. Do not wait until you're diagnosed with a full-blown heart blockage. When you start changing dietary, physical activity, if not, calcium CT score, if there is some, start taking the statin, will prevent future heart attack when the same person reaches 40s and 50s and 60s. That's
Yeah,
what I would.
yeah. And Dr. Babawi, what are some of the symptoms for those who aren't sure about their family history? What are some symptoms that would tell them that there might be a problem with their heart?
Might be no symptom at all. People when they have diabetes, sometimes they don't present with symptoms. It just was found because a lot of people here, like Dr. Gola mentioned, do not do much of an activity. Imagine if you are like, I'll go back to the example or the analogy I use is your leg is having a problem, and if you're not walking, you're not going to have any pain in your leg. But if you start walking and exerting yourself, that's when you're going to start feeling pain. So exerting yourself or doing your daily activity will simply unmask such symptoms, which include chest pain. There are typically chest pain that when we hear the story, we think this is at least 90% from the heart. And there are other people who present with what we call atypical or unusual chest pain. Ladies in general do not present with such chest pain. I had one patient who used to go to the hospital with a heartburn that happens when she walks. Usually heartburn happens more after eating or something. She was like having this for 1 year. And then when I took her to the cath lab, I found that her widowmaker is 99% closed.
Wow.
So atypical symptoms. So that's when we say primary care, and primary care. You have to be connected to a primary care physician to calculate your risk rather than waiting for the symptoms to develop. We talked about the calcium scoring. We talked about like checking the lipid, checking the cholesterol, checking the diabetes level, blood pressure control, smoking habits, losing weight, exercising. And then some people present with not just with chest pain, some people present with shortness of breath. You cannot keep up, the heart cannot keep up with such an activity because the muscle is weak. So that's one thing. Third thing is we see people who have been having decline in their activity. Their activity hasn't been the same. I keep asking and say, like, in the last 6 months, have you noticed a decline that is not intentional, meaning you did not want to sit in your bed or at home, you just decided to walk, but you cannot keep up with your activity. So one of these three are the most common ones. Chest pain predominantly is a major thing we look into. But again, I keep like mentioning that there could be silent, and that's because of the prevalence of the diabetes. It can lead to a lot of silent heart attack. So it's better to act on it before it happens. When it happens, we will work on it, but I'm afraid that when it happens, that the damage can be sometimes irreversible.
Yeah, that's the scary thing about it. We're talking with Dr. Mahesh Golan, Dr. Bishoy Babwe, about cardiology and cardiology interventionists. We need to take a quick break, and we'll be back with more of The Hub right after this.
The Hub is presented by Calvo Enterprises, Inc. The Hub is presented by Calvo Enterprises, Inc.
All right, welcome back to The Hub, everyone. I'm Master Lecanto speaking with Dr. Mahesh Golan, Dr. Bishoy Babwe, talking about cardiology and its prevalence on Guam and some of the symptoms and the signs to look out for. I wanted to kind of ask you, you explained earlier in the show, what brought you to Guam, and of course, you're very much welcomed. And your presence here, especially for heart patients, is well received because you talked about the immediacy of it. When someone has a heart attack or stroke, they need to see a physician such as yourself right away, right? Dr. Babwe, talk about that, the immediacy and the importance of being seen right away.
Yes. There are many things that we work on in cardiology to talk about immediacy. There is the prevention we talked about. We have been stressing about throughout the interview about working on the risk factors that can be done by the primary care doctor. And if there is further concern, they come to us and we risk stratify these patients with a stress test, with a calcium score, with a CT, whichever we think it's appropriate for the patient to really find out if there is any cardiac underlying to explain underlying cardiac problem to explain the symptoms. The immediacy is between mortality and morbidity. So we talked about mortality, which is a life or death situation when it comes to coming with a major heart attack, and we act on that very seriously. Our team we make sure our team is available within 90 minutes from the patient arrival to the ER. Most of them, we open the artery in less than 45 minutes, and we get them settled, and usually stay 1 or 2 nights after that, and they go home. And like I mentioned, we talked to one of your family members who had a heart disease. They will tell you the experience, if there was intervention, if there was none. So at some point, there was no interventionist on island. So patient used to come and get medication, and that's it. But now with us being available 24/7 on island to really help our patients to survive such a mortality. The morbidity part is the symptoms that I mentioned. The quality of life. You will not have a great quality of life when every movement you do, you get chest pain. When you cannot keep up with your activity. I had 2 gentlemen, and actually 3, who got their heart attacks mainly when they were at the gym. The first one was running 5 miles every day. And he noticed over the last couple of days before he presented that he cannot keep up with that. So he saw another non-invasive cardiologist who looked at his EKG, and he felt that he should go right away to come to be evaluated by interventional cardiologist. Took him to the cath lab. He also had a widowmaker of a 99%. Get fixed. I saw him in the follow-up. He's back on his activity. Next one, similar situation. He was running every day 5 miles, and then that has been declining. So he listened to his body, and he felt that this is a change, and he sought advice, and we fixed the problem. And the third one was, he was mainly at the gym, just starting his workout, and he felt that the chest pain is different than anything like a heartburn or something that he gets. And he came, and it was a major heart attack for him, and he did very well. So we have the ability and the tools to make people's life better and to save lives, but the initiation part is the person or the patient listen to their body and feel that what's going on is not abnormal and I should seek care. That is the starting point. If that does not start, then our job cannot be completed.
Yeah, well said. We've only got a couple of minutes left, so I wanted to end with you, Dr. Gola. We, of course, welcome both of you here to Guam. You're much needed, and we're glad you're here. What we wanted to ask you is, how do we attract more specialists to Guam besides cardiologists? Give us some advice. You both came from off island to work in Guam. Something attracted you here. How do we attract more specialists, medical specialists to Guam, Dr. Gola?
I would say that's a little complicated question, but I only shared my opinion. Most of the young subspecialties, they are not aware of this location, especially foreign grads, So if one way you can educate people, hey, there is a hospital, an island with a 160,000 population and with excellent disease prevalence and excellent benefits and super beaches and living style, and these are the things they usually they kind of fond of out of training. And the salaries are one thing and living style is another thing, and work-life balance is most important thing out of all. So I would definitely reach out to more programs, fellowship programs where graduates are, coming out once they know about this hospital is existing and these two GMH and GRMC. So they definitely look into the prospects of it. They visit. Once they visit, I'm sure they fell in love with this place. So the next thing is it is a little USCIS dependent approach. The local politicians know about it because I recently went to a meeting in GMA. The thing called J1 waiver. It's an immigration based approach through Department of State and USCIS. So most of the physicians on the mainland, foreign nationals, they do their training on J1s. Once J1 is completed, their transition to work visa is not easy. So they have to do a process called J1 waiver, which is a 3 years of J1 waiver in underserved areas. So that's where that your market opens. All these subspecialty physicians, predominantly foreign nationals, they're going to small community hospitals and acute care hospitals to provide specialty care. Guam perfectly fits underserved areas. If you reach to those physicians who are doing J1 waiver training, if you tell them, hey, come and visit us and see what you think, I'm sure they're gonna sign up for a minimum of 3 years of subspecialty cares in Guam. That's another political and immigration based to bring physicians to the island. That's what I think.
All right, that sounds like some good advice. Dr. Mahesh Gola and Dr. Bishoy Al-Babawi, thank you so much. Interventional cardiologist at the Guam Regional Medical City. I'm Nestor Lecanto. Thanks for watching, everyone. We'll see you again next week on The Hub.
Thank you.
Thank you.